My name is Boo Prince, and this is In Conversation on Ashdown Radio. As always, I have a wonderful guest with me in the studio, and this evening I'm delighted to welcome osteopath Tim Coysten. Thank you for being with us, Tim.
You're very welcome. Good evening.
So, Tim, I want to start off the conversation with learning a little bit more about you. You are locally based. You practice in Crowborough, and I'm sure many people will actually know you. Many people will have been sort of on your therapy bed and so on. But where did it start for you? Are you a local lad?
So, yes, I grew up over the other side of Paddock Woods, where my mother still lives. I went to the Judd School, and it was actually whilst at school that my father injured his own back in the garden in about the 1970s. And he was, bent over double, couldn't walk, and he used the kitchen chair to get him sort of down the garden and into the car, and took him to the local GP. Who said 3 months off work, painkillers, bed rest, anti-inflammatories. And my father said, there must be another way, this day and age, man on the moon, that sort of thing. And he said, well, actually, when I have your problem, which I do, this is the GP, I go and see this man, and took the business card off the osteopath out of his top pocket and handed it to my father. And he said, I trust this man because he trained first as a GP and then retrained as an osteopath. And his name was Dr. Mildren. And in fact, he was based here in Crowborough. So my first experience of osteopathy at all was in Crowborough, which is kind of circuitous since we're now living and working in Crowborough ourselves.
Wow. So say his name again, Doctor?
Dr. Mildren.
Mildren.
Yes. Now, it was a long time ago, and I think he's certainly will have retired by now if he's even still around.
Yeah. How amazing. And I this really strikes a chord with me, Tim, when you talk about the painkillers, the anti-inflammatories, all of that, because it does tend to be the sort of standard route, doesn't it? That when we go to the GP, more often than not, we're expecting to walk out with a prescription, as opposed to necessarily advice.
Indeed. And it's very difficult because everybody's back pain may look and feel the same, and it may be described the same, but the causes are many and varied.
Yeah.
And it's something which they study obviously to a great level, but they can't know everything about everything. Whereas we are, we obviously look in much more detail about the biomechanics of how the body works, and understanding how joints can become misaligned. That's probably the biggest difference between what we do and what other medics will do, is that we have the concept that joints can become misaligned. And if a joint is misaligned, you can't exercise it straight because it's like a wonky hinge. You can't use a wonky hinge to straighten itself. You need someone to straighten the hinge, and then you can exercise it better. So
I'm going to get more into kind of osteopathy itself as we go along. But tell me about your dad and the injury, and because this clearly had quite a deep impact on you. I mean, he must have hurt himself badly.
Absolutely. So, when you're, probably about 7 or 8 years old, your father is invincible. He's unbreakable. But when you see your father literally kind of yelping in pain and can't stand himself up, can't sit down, nothing's comfortable, it's quite a sort of a moment of transition.
So your father went to go and see Dr. Mildren. And what happened from that point?
So genuinely, he was carried in, and about half an hour later walked out looking somewhat bemused, almost sort of looking over his shoulder and feeling his own back. But he was upright, he was under his own steam. And I said to him, what did he do to you? He said, I've got no idea. I said, you must know what he did. He said, no. He said, he laid me on my side, put me in a funny shape, jumped up and down, something went crack, and it hasn't hurt ever since. So I thought, well, that's kind of like, that's incredible. And I'd always wanted to do something medical, but didn't really know what options there were. I was, say, 7, 8 years old, but I'd always felt this. I loved the way the body, everything about the body just fascinated me. So any time I heard anything about the body, it interested me. But I also seemed to have a capacity to remember it. So it's like it just kind of fitted in my brain. And then when I sort of thought, okay, well, if the doctor has a problem and the doctor goes to see the osteopath when the doctor has a problem, well, perhaps I'll be the osteopath. And that's sort of where it started. And then I was probably about 14, so a few years later, and one of my friends at school. He had an older brother, and we were at the father's 50th birthday party. And my parents were talking to my friend's older brother, who was just about to go and study osteopathy himself. And he was telling them all about it. So I got someone to go and listen to this conversation. And he described osteopathy to me, and I thought that just sounds like me. And we're talking about, I was 14, so, we're talking about the early 1980s probably. And there was no internet. So he had done the donkey work to find where all the colleges of osteopathy were, which in those days there were 3. And he had the prospecti from the different colleges. And he said, well, I'll let you have those, and that gives you the information you need. So he gave us this little folder of all the stuff that he'd researched and found, because he had chosen where he was going. And that then gave me the sort of the direction to go. So I selected my O-level choices, A-level choices. So I studied biology, physics and chemistry to A-level. And that was that. So that was where it took me into osteopathy. And I felt almost like osteopathy chose me rather than I chose it, because it just sort of happened in such an organic way that it just made sense to me.
Do you know what I find remarkable, Tim, is, I obviously speak to a wide variety of people and we talk about their careers and all this kind of thing. I'm often astonished at how young people are when they actually feel the calling in a particular direction.
Absolutely.
You have this very clear vision of being 7 or 8 years old. I know this will make you laugh, but it's true. I literally got my first microphone when I was 2 or 3 years old.
There you go. Exactly.
My favorite toy ever.
Yeah.
So, I just think as parents, we also need to really listen to what is drawing our children in particular directions.
Absolutely. And again, bear in mind, when we're talking about osteopathy, was almost unheard of. It was most unusual. So my parents were very supportive in allowing me the fantasy, if you like, to go and study this weird thing that, although my father had obviously good experience, but it wasn't something that was broadly spoken about and not widely known. But equally, my brother, who is now an internationally renowned artist, through his work, his work. You don't know it, but it's out there all around us. He was equally given the same sort of benefit by my parents in allowing him to pursue, which equally an artist, you can imagine how you might think that's not going to give you much of an income. But, he's done very, very well. So the open-mindedness of our parents really allowed us to explore those different avenues, which were not traditional sort of aspects or avenues that were open or discussed. In fact, when I spoke to my careers master when I was at school, we have a careers meeting, what career do you want to, what do you think would be good for you? And he said, have you got any ideas? And I said, I want to be an osteopath. He said, what, where, who? Yeah. And I said, an osteopath. And he said, well, where do you need to go for that then? So I told him. And what A-levels do you need? So I told him. So that's very good. He said, can I be of any more assistance? And I thought, well, I think I helped you more than you helped me. But the reality was, it was so small, so minor. But these days it's become bigger and bigger, of course, and osteopathy now is recognised in statute. So it's come a long way since I started training. And I love it.
So going back to your parents, what do you think made them so open-minded and so kind of tuned into you and your brother and your particular talents and draws? What did your dad do, for instance?
So my father was a railways engineer, and although he loved it, when I once sort of said to him, do you think I should do the same as you? He said, no, don't do this.
Right.
And I think he recognised, although he loved it, it still gave challenges, because work obviously becomes a thing there's always a love-hate relationship. I think with work for many people, and I think he understood that to do something which you enjoy is probably more important than doing something which just earns you money. So I think he had learned through his own experience that doing what you love is probably a better. And I think it's their kindness really that allowed them to explore those opportunities rather than say we need to do this, we need to do that, or trying to kind of funnel us in the direction which they felt would be maybe financially more rewarding. Perhaps, I don't know, but I think it was their kindness and their attitude to life. It's sort of keep an open mind, see what happens, and always look for the positive.
I'm fascinated that you particularly pinpoint kindness, because it's something that I also notice. I mean, not only in sort of your demeanor and the way you deal with patients and so on, but I think that it's part of the healing practice, isn't it? To have compassion and empathy and a sense of kindness towards people.
Absolutely. So it's interesting how when people start training, they have those things in common. Not many people go into the healing arts, shall we say, because they want to make money. They do it because they want to help people. So that motivation is already, and as you said, it's almost like a calling that sort of comes from the inside. And that's the same for many professions, of course. But I think that's true, that people are drawn to this because they want to try and help people. And then the sort of the technicalities of how you do it becomes just sort of what you're trained to do. But the personality that took you there in the first place is what shines through and what makes you the osteopath or the practitioner that you become.
Absolutely. Well, my guest in the studio is osteopath Tim Coysten, and we always ask our guests to choose some of their favourite songs to share with us. So, Tim, before we carry on, what is one of yours? What have you chosen for us today?
So the first track we have is a track called Cloud Busting by Kate Bush. And I just love Kate Bush. There's something just unique about the way that she sings, the way she performs. And the more you read into, if you choose to, her story, I just find it more fascinating.
Brilliant. Here you go. Kate Bush, Cloud Busting. Welcome back. My name is Boo Prince. This is In Conversation. And of course, my guest in the studio this evening, osteopath Tim Coysten. Tim, we were talking a bit about your early journey as a kid and being drawn to this, at that time, really quite unknown profession of osteopathy. And I do have to admit that when I first arrived in the UK, I saw notices everywhere for osteopaths, and I thought, oh, there must be bone doctors, because I'd never heard of an osteopath before. Can you give us any sort of insight into a little bit of the history of osteopathy at all?
Absolutely. So there was a guy called Andrew Taylor Still, who was an American doctor, he found that they were killing as many patients using the kind of medicine that they were using at the time. So he lost a couple of his own children to diphtheria. We're talking about the 1870s, 1880s in Kirksville, Missouri, in America. So he had this sort of burning sort of problem inside. He just wanted to try and help patients, as we said before. And having lost two of his own children must have been devastating. But he, as the story goes, he one day had a headache, so he went to have a sort of a lay down in the garden, and he rested his head in the bottom of a rope swing that they had in the garden for the children. And he sort of fell asleep there with his head resting on this rope. And he woke up sort of an hour later without a headache. And he thought, oh, that's interesting. Maybe there's a connection between my neck and headaches. So he started looking at the anatomy and physiology, and he postulated that the blood flow, drainage and alignment of the body was important for how it worked. So he started looking at manual techniques to try and find these restrictions, find these problems, and then work to try and straighten them out. And he started getting good results. And people learned about what he was doing, so people travelled from far and wide to come and see him, and he sort of it grew from there really. And he had people who wanted to study, so he had a few sort of people that wanted to become like disciples. So he eventually started the College of Osteopathy, the first College of Osteopathy, and he the first graduating year of osteopaths was 1893, and I remember this because I was the year of 1993, so 100 years later.
Wow.
Although not from Kirksville, I qualified at the European School of Osteopathy, which is in Maidstone. But yes, one of those first disciples of Andrew Taylor Still, a guy called John Martin Littlejohn, he came over to the UK in about 1900, and he established the British School of Osteopathy, which is still existing in London today. Although I think it's now called the University College of Osteopathy. But that was the first College of Osteopathy established here. And then the other ones which developed became sort of offshoots from that one, which includes the one that I trained at. But it's a holistic form of manual medicine. So we look at how the body works and try and help it work the way it was originally intended, to sort of iron out the bumps and kinks that life may have thrown at us, on our journey between, first being born and coming to present to the osteopath with a low back pain or shoulder pain or whatever it might be.
I love the way you talk about bumps and kinks, because that is very often how it feels, isn't it? When you're sort of battling to move and you're in pain and whatever, you almost feel like a rope with an sort of permanent kink in you that you just can't even out. So,
and that's the interesting point, because actually most people, if you talk to them, if they have had these sorts of problems, they resonate with the idea that they're trying to find a position that's going to make it feel better. So they might lean over
click.
things. Exactly. Stretch over the back of a chair, twist, pull, bend. And that brings me back to a point which we sort of touched on earlier, which is that unfortunately, if a joint has become misaligned, it no longer works the way it was intended. So you can't use that joint to correct itself because it doesn't work right. So that's why I have a job, or we as osteopaths have a job, because we can find those joints and we can realign them. I like to think of joints as like teacups in saucers. So if the teacup is in the saucer, the joint is located. The teacup's out of the saucer, it's dislocated. Now, clearly we don't deal with dislocations very often, and if we do, then obviously there's a hospital that deal with those things better often than we can. But if the teacup is in the saucer but not quite sitting in its little divot correctly, it's not correctly seated.
Yeah.
And in the same way as the teacup, if it's not quite sitting correctly, if you don't move it, it's fine. Move it the right way, it might be okay. But if you move it the wrong way, it might wobble, tip, and spill the tea. And it's exactly the same with the joint. If it's not quite sitting its normal, neutral home position, then if you try and move it, it might be okay. But if you move it the wrong way, you've got a little stab of pain, a little spasm, a little, ooh, I shouldn't have done that. And those movements are unpredictable, because you might perform what looks like the same motion, but for your body it may not be exactly the same each time. And if that joint is provoked in the wrong way at the right time, then that's when you get a little message back saying, don't do that. And of course...
And the message is usually pain.
Exactly. And pain is your body's way of telling you that something is wrong. It's saying, don't do that because you're causing damage.
Right.
So to push through the pain has some merit, but you are ultimately causing damage. So if we can find a way of normalising the alignment, that normalises the function. The muscles will respond to what the joint is asking them to do. So if you have a tight muscle in a painful joint, it's usually the joint that's making the muscle tight, not the muscle making the joint tight.
Well, this is one of the things that I think for a layperson like me, sometimes we don't really understand the difference in how we are being treated by different practitioners, right? So, for instance, one of the things I find confusing is how would one define the difference between what a physiotherapist does and what an osteopath does and maybe what a chiropractor does? Because for the I'm sure in the profession, people are kind of shaking their heads and going, they are so different. But for the layperson, if you're in pain, you don't know the difference. You just want to find somebody who can help fix.
So what I always say to people is it's more important about the person that you see than the profession that they have. So there are differences of approach broadly between the disciplines. However, the individual you see will have their own take and their own view. So I know some extremely good osteopaths, and I know some extremely good physiotherapists, and I know some extremely good chiropractors, but they're not necessarily all extremely good, if that makes sense.
Sure.
So I would always say to patients, it's more important that you feel that you trust the person, you feel comfortable, and you feel like you're getting somewhere, you feel like you're making progress. Going for treatment that makes you feel better, but you have to have it done again next week to make you feel better, but you have to have it done next week to make you feel better, and that goes on and on. That's not treatment. For me, treatment should be resolving the issues that are leading you to have pain in the first place. And as such, hopefully, we can do just a few sessions and actually see a progress in in the symptoms you have. They should be diminishing symptoms, less easily provoked, and fewer and far between.
Absolutely. I want to touch for a moment on something sort of slightly different. When I've had osteopathic treatment, I have been astonished at just the kind of gentleness, it almost feels like magic, the level of gentleness that you guys use. How much of it is actual movement and how much of it is almost like laying hands on someone, like healing hands? And I know there's science behind it, so don't think that I'm, disrespecting that, but there is something about the ability to feel and through the gentleness of touch, which is incredibly healing. Can you just talk to me a little bit about that?
Absolutely. So if we think about aligning joints, it doesn't really matter what you do to those joints as long as you get them to align better. And there's a feedback loop between the stretch receptors in the joint and then the muscle stretch receptors and the muscle drive, the nerves that drive the muscle to make contraction or relaxation. So if you guide the joint in a better position, it will recognise it's in a better position, and it will tell those muscles which have been tight to protect it that they no longer need to be tight because it no longer needs the same protection. So literally just applying a very gentle pressure on the joint, if you're pushing it in the right direction, it will recognise that that's a good place for it to be, and it will start to relax automatically. You don't need lots of pushing and shoving. I often say to patients, people are generally underwhelmed by what I do and then surprised it makes a difference, because it's about gently aligning things. Although obviously we need to be effective. So, it's sitting there for hours, which achieves nothing. Well, that's not going to help anybody. But that's the magic. The magic's in the body, really. Of course, understanding what to do, when to push, where to pull, where to twist. That's the biomechanics. That's the understanding of how the body works. But the magic is in the body. The body is I always think of it, we're restoring factory settings. We're getting things back to where they should be. And then the body does an update, and then it just works the way it was originally intended. But as far as healing hands are concerned, there was a study done I think it was in the 1970s by the NHS. And they looked into whether different tissue types in the body would heal under different electromagnetic waveform sort of frequencies. And they discovered that, yes, they do. So each of the different tissues in the body has a specific bandwidth of frequency that under which it repairs significantly more rapidly than under other electromagnetic waveform, which is already interesting. But the thing that I found most fascinating is that those frequencies all fall within the spectrum that the human hand can emit.
Wow.
So the human hand is basically built to heal people. So if you have an upset child or an upset parent or friend, there's a natural inclination to put your hand over their shoulders and maybe just rub them between the shoulder blades. So that's close to your heart, close to the heart center, and that's obviously where we're upset. That's where we tend to feel these things. So just that massaging there will have effects through the neuronal system, but maybe there's also an electromagnetic connection between the empathetic touch and the person that needs that touch.
Wow, that is really powerful. I wasn't actually, it makes perfect sense when you talk about, the frequencies that our bodies are able to transmit and so on. But, you don't really walk around thinking I'm transmitting
No,
frequencies.
Indeed. It happens inherently. And I think part of what happens when we're training is we learn how to amplify that, not because we're told to amplify the frequency, but we're learning how to be thoughtful and respectful and empathetic with our contact with the patient. It really is there's an interface between us.
Yes.
That as soon as you make that contact, it's like you're covering that gap in a completely different way, obviously. So that sense of touch, it has to be right, otherwise it can be, it can cause a negative reaction in the patient.
Totally. Okay, we're going to continue with osteopath Tim Coysten in just a moment. But Tim, introduce your second choice song for us. Everyone's going to love this one. I love this one.
This is Pink Floyd, Wish You Were Here. So Pink Floyd, probably one of my favourite all-time groups, I'd say. And I actually had the good fortune to see them live once, which is I feel very privileged to have done that. This one's called Wish You Were Here. And it's taken from the album of the same name. But it's an album which my father bought me once home from America. So he'd been gone for a while, and this was what he brought me back, was a CD of Wish You Were Here. And sadly, we lost my father a few years ago, so I wish he was here now.
You're listening to Ashdown Radio. My name is Boo Prince, and this is In Conversation. Thank you for being with us. My guest in the studio this Monday evening is Tim Coysten. Tim is an osteopath, and he's locally based in Crowborough. And we were just chatting about kind of human frequencies, the frequencies that our bodies are able to transmit, and sort of healing touch and all these amazing things. And Tim, it made me think for a moment about the incredible importance of holding someone's hand, putting a hand on someone's arm when they're upset. Like you said, putting your arm around their shoulders, the simple act of giving someone a hug, how incredibly, incredibly important and healing those very simple gestures can be. And it makes me really sad that we don't perhaps do them as often as we used to, just because so many of our interactions are digital. And, getting a smiley face emoji is friendly, but it's not quite the same as a hug, is it?
It's a very good point, actually. It's one of the things that when we were studying, because we were all like-minded people, it was just a college of osteopathy, so we were osteopaths surrounded by osteopaths and being taught by osteopaths, and it was like being immersed in osteopathy. It was like, wherever you had conversation that you could hear other people talking about osteopathy, it was extraordinary. But we were all huggers. We'd sort of, you meet someone, you see, even if you've not seen it, if it's just been a few hours, you just sort of welcome each other with a hug, and it just became part of what we did. And it's kind of interesting how, I think if you offer someone that, then they are less likely to pull away from it. But if you don't offer it, then maybe they're not so often likely to offer it. So I'm definitely from a hugging family, should we say? And in fact, it's one of the things my wife said that she liked about me the first time she met me with my family, was that I just hugged my father when I sort of first time I walked in through the front doors, and she thought that was nice because her father was the same with her and her brothers. Right. So there's something about human touch is really important, and as you say, unfortunately, digital age, we are arguably being driven apart. People working remotely, don't even spend time in the same room with people.
And even that, that's an interesting point, because even in an office setting where you might shake hands with somebody, it's not necessarily affection, it's not necessarily intimate, but that thing of the kind of physical acknowledgement of another human being. Yeah. There's something really profound about that. Indeed. Kind of sharing electricity.
Well, there you go. Yeah. There you go. Yeah. And obviously time and place, but yes, it is an important part of our interaction. And it's something which I think if you've grown up with it, then it just becomes very natural. But if not, then it can be a challenge for people.
Tim, before we run out of time, the one thing I do just want to get a little overview from you about is, I'm sure there are many people wondering what are sort of the range of things that osteopathy can help with. I mean, I've had experiences with from neck to back to, bad shoulder or gammy leg or whatever. Can you just give us a bit of scope?
So I think the way to sum it up really is that if the body is dysfunctional, it will give you a symptom. And if you can understand that dysfunction and you can encourage that normal function to be returned, then it can help anything. Now, that's not to say we can treat everything, and clearly there are, medical conditions that I can't treat, but you can treat the person that has those. So, I have patients who come with neck pain, and in the conversation it turns out they get migraines as well. But by helping the neck work better, we can often improve, ameliorate, or even resolve the migraines.
Wow,
because there's a mechanical component to that, blood flow, drainage, as we said at the beginning. Patients come with all sorts of weird and wonderful symptoms. And what I've found is that actually just by balancing the way the body's working, even if it's not clear that you've ever treated this symptom before, and there's not osteopathy, we used to talk about push-button osteopathy. It's not, this is the condition, this is what you do. This is the condition, this is the person. We treat the person to normalise their biomechanics, normalise their physiology, restore their what we call homeostatic balance, so the body is enabled to repair itself, and then you let the body heal itself and see where you go. So some things we can improve, some things we can't, but almost everybody could benefit to some extent from a treatment if they feel any sort of symptom.
One of the other things that you do, Tim, is you actually teach. You teach postgrad students in osteopathy.
So I certainly, when I first qualified, I was invited back to the college to teach. And because my father was an engineer, I was a bit odd, so I'd ask lots of awkward questions about how does that work and why do we do it like that. So there's quite a few things which I was taught, which I've kind of modified or rehashed. So what I do is kind of slightly different, but it's based on biomechanical principles. So my MO, if you like, is to look at the foot and work up. So if you're standing and you've got low back pain, but you're without knowing it, you're standing with more weight through your left leg because your right knee's a bit twisted, even if you've got no symptoms in the leg, then that will already start to put the back on edge. So I find the best way to be successful in solving people's dysfunction, people's pain, people's problems, is to be thorough. So I said to one of my colleagues a long time ago, I gave up trying to be clever. I'm now just thorough. And he said, actually, that's quite clever. So, and it came from experience. I had a patient many years ago who came with knee pain. So I took the case history, asked him about any other pains, no other pains, fine. So I treated his knee. He came back the week later, and I said, so how's your knee been? He said, my knee's been much better, so is my back. I said, well, I asked you about a back. You said you didn't have a back problem. He said, well, I've had a back problem for many years, but I didn't want to waste your time because no one's ever been able to help it. He said, as soon as you straightened my knee out, my back stopped hurting. And that's when I started thinking, well, of course it makes sense. If we are standing on two legs, we should understand the underpinnings. It's a bit like any kind of structure. If the foundation's not working right, you wouldn't start renovating a roof before you check what the foundations and the load bearing walls are doing. So for me, I had this thought the other day. The skeletal system we could liken to the poles inside an old-fashioned tent.
Right.
So the body that you see is like the canvas that hangs over that skeletal system, those poles. If the poles are a bit wonky or they're not aligned correctly, it's not going to look right. And it certainly isn't going to work right. But if we can straighten out the poles on the inside, then the body will start to look and therefore almost by default start to work better.
Tim, we are very, very nearly out of time. The one last thing that I do just want to say is you and I had a fascinating conversation actually a few weeks ago about emotions and the effect of our emotions on our physical body. And I remember I said to you that a bit over a year ago, I was going through a period of intense grief at having lost a friend and who had passed away, and I landed up putting my back out. And I just wanted to pinpoint that for people, because I think sometimes we think injury is, because you've fallen over or knocked yourself or whatever. but actually we are whole beings, aren't we?
Absolutely.
And something that happens to you emotionally can also have a profound physical effect.
Absolutely, and there's quite a clear biomechanical connection, in fact. But years ago, when I first qualified, I've been in practice over 30 years now. So when I first qualified, patients were coming because they remember doing something. But very often these days, patients come and say, I don't know what I've done, but my back just hurts. And the connection is if the pelvis goes wrong, which it most commonly does, causing low back pain, and even sciatica, if the pelvis goes wrong, it's going to give you lots of problems in the low back and into the legs. If that goes wrong, the part of the spine that compensates is a bit higher up, which is where the diaphragm attaches to. And when we feel grief, anxiety, stress, these things, that tightens the diaphragm. Because we get anxious, we sort of, it's like you take that scared breath in and you don't let it go. So if the diaphragm is locking the spine in the place where it should be compensating for the bit that's wrong, then it can't compensate for the bit that's wrong in the pelvis, and then you start to get the symptoms. So that's the connection. So very commonly, there is a biomechanical underlying problem, which is highlighted by the stress, the grief, or the anxiety.
Tim, thank you so much for your time. Thank you for sharing your story and your wisdom. I really, really appreciate it. And I know you have got one last song that you are going to share with us, which I think feels very appropriate.
Indeed. So this is Dire Straits' Brothers in Arms, and it's just a song, I think, about connection. And again, it reminds me of my family. So Brothers in Arms.
Here you go. Thank you for being with us.
Thank you.
That's osteopath Tim Coysten. Here you go with Dire Straits, Brothers in Arms.